All right. So today's agenda will focus on, we kind of highlight who we are. I think a lot of y'all know if you were on the last call, a little introduction, the objectives, legislation review, and then we'll go through a Palestine resource guide. While we go through the legislation review, we also will be utilizing the advocacy tools that we learned in the last call, the different methods of advocacy, and using that in action, focusing on the specific healthcare legislation that we are talking about. So quickly, as a recap, AMHP is a national nonprofit organization focused on fostering collaboration between Muslim professionals from diverse sectors of healthcare, seeking to advance public health. We use advocacy as a tool to influence policy change, and this webinar is really focused on the different ways to use advocacy, specifically in the healthcare space. Ultimately, we are using our voice and resources to call to attention a cause is the best start. And our advocacy work is focused specifically on healthcare legislation. We do have mental health work that we do and professional development work that we do. So our objectives for today's webinar, we're going to review legislation. I want to highlight that this will not be a deep dive into legislation. I'd love nothing more than to sit and talk about one legislation for hours. But if we did that, we could keep going for a very extended period of time. So what we will do is we've picked 3 pieces of legislation that AMHP is currently investing a lot of time in. We're going to review those legislations, do a high-level understanding, understand and build comfort with your advocacy work supporting that legislation. And again, these are all transferable skills. So we're walking through how to analyze this legislation. But again, once you figure out how to utilize congress.gov and you have more experience with that legislation, these skills can be used to figure out legislation that you are supporting and you feel most connected to. We will then take the legislation that we've reviewed and we've really talked through, transform it into an advocacy method. So we'll kind of walk through email templates, phone calls, social medias, posts. That way we're building together and bridging the 2 parts of our advocacy training. And then we'll talk a little bit more about how you can get involved. At any point, if you have questions, please put them in the chat. A lot of us are on here, can monitor, or you can stop me and ask me if you think of something. So our health policy and advocacy work is broken up into 3 different buckets. So when we're choosing legislation to support and advocate for, we're categorizing them into 3 of these different spaces. This is not to say that we're not picking up healthcare legislation that may not fit in this direct angle, which most of them do. This is just more so for organization purposes and how we can prioritize and how we can utilize our advocacy to support them in the correct manner. So we have one approach to health policy and advocacy is looking at direct healthcare legislation. So healthcare is a fundamental human good because it affects our opportunity to pursue life goals. It reduces our pain, suffering, helps prevent premature loss of life, provides information needed to plan for our lives, and society has an obligation to make access to an adequate level of care available to all members, regardless of ability to pay, regardless of resource access, regardless of any angle that makes communities marginalized. So one legislation that we focused on is the HEAL legislation, and that falls into the healthcare bucket. The next angle that we're looking at is health equity, and that is the state in which everyone has a fair and just opportunity to attain their highest level of health. So you're achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices, overcoming economic and social barriers, other obstacles to healthcare, access to healthcare, and eliminate preventable health disparities. So this is kind of looking at high-level things to make sure that access is equitable. And this piece of legislation that we focus on is baby bonds. Again, we'll break these pieces of legislation down a little bit further into the conversation. The third angle of health policy and advocacy work that we look at is broken up into the social determinants of health angle. We talked briefly about social determinants of health on our last call, but just as a reminder, social determinants of health are the conditions in the environment where people are born, learn, live, work, play, go to, worship, religion, community spaces, and the ages that affect a wide range of health, functioning, and quality of life, which ultimately impacts outcomes and risks. So you're looking at essentially the holistic part of a person in their community and saying, how does that impact a person's health outcomes? And that piece of legislation is the omnibus legislation that we're looking at. So now we're going to transfer into breaking down the 3 pieces of legislation that each fall into 3 of these buckets. So the first legislation that we are looking at is the Health Equity and Access Under the Law for Immigrant Families, the HEAL Act. I see a hand up. Yes, Bonnie.
Hi, thanks. I had put a note in the chat, but then I realized presenters can't see it. Can you slow your speech down just a little? I'm having trouble following you.
Yes, I can absolutely do that.
Thank you.
So the Health Equity and Access Under the Law for Immigrant Families is known as the HEAL Act, and the HEAL comes from the Health Equity and Access Under the Law. This bill number from the Senate side is 2646, and from the House side, it's HR 5008. So this legislation, what that means, has been introduced on both the House and the Senate side. The bullets on the screen are high-level understanding points of what this legislation stands for. All of you will get access after this training to both of the recordings of the trainings, a toolkit with templates, and also detailed pamphlets that break down this legislation that you can use in your own advocacy work. So the HEAL Act talks about this idea that everyone should be able to have access to the healthcare that they need so that they can take care of themselves and their families with dignity, regardless of their immigration status or how long they've been in the United States. This is now even more true as immigrant families and communities continue to come and grapple with the devastations post-COVID. You're looking at barriers to federal health insurance programs that disproportionately harm Black, Latinx, Asian American, Pacific Islanders, Indigenous, and immigrants of color, and contribute to persistent inequities in the prevention, the diagnosis, the treatment of health conditions. So all that to say, people who are in this country, regardless of how they are here, should have access to healthcare, because ultimately people deserve access to healthcare. So as we work to undo this harmful legacy that has been left behind, we need bold and impactful legislation that expands access to basic care that families and immigrant families need and deserve. So ultimately, what does the HEAL Act do? The Health Equity and Access Under the Law, HEAL, for Immigrant Families Act of 2023 removes political interference and restores coverage to the immigrants in the United States so that they can participate in the health insurance program for which they would be eligible for, but their immigration status or their length to stay. So this bill allows immigrants and their families to receive the health care coverage they need and deserve to ultimately create healthier communities and more equitable care, and ultimately create a prosperous economy. So specifically, this bill will restore enrollment to full benefit Medicaid and CHIP, and CHIP stands for Children's Health Insurance Program, to all federally authorized immigrants who are otherwise eligible. It removes discriminatory legal barriers for health coverage for immigrants imposed by other acts that have existed. And specifically, it eliminates the 1996 law that restricts the 5-year waiting period for qualified immigrants to access Medicaid and CHIP. So that is the big portion of this bill. People should not have to wait 5 years after immigrating into the United States lawfully to access healthcare, access, and insurance. So through these changes, the bill ultimately is ensuring that all individuals are granted federally authorized, even DACA recipients are eligible for federally funded healthcare programs, removing discriminatory Medicare eligibility requirements. You are codifying the access to public and affordable healthcare coverage for DACA recipients. You're ending discriminatory exclusion, and you're encouraging you're creating a state option plan for states to elect to expand Medicaid and CHIP eligibility to undocumented immigrants who otherwise would not be eligible. So a wide range of things that this bill does, but again, on a high level understanding, it is removing barriers so that immigrant families who are in the United States and immigrants have access to healthcare insurance and federally funded healthcare programs because they have been here, and that they shouldn't have to wait the 5 years to access these benefits. Now, this is a direct healthcare bill, and you can probably follow why this specific legislation falls into the healthcare bucket, because it's directly impacting people's health outcomes because of healthcare access. So currently, this bill has, I believe, 73 co-sponsors in the House and 9 in the Senate. We are looking to increase co-sponsorship to 100 in the House and 15 in the Senate. That is the goal of next year. AMHP actually sits on the rewrite subcommittee for this bill. So this is a bill that we are particularly involved with. The rewrite for this Congress and the lobbying and advocacy work we do focuses heavily on the HEAL Act. So again, you can find the co-sponsors, the status of the bill, the number of the bill, and where it is on each side on congress.gov. And that was something that we kind of walked through in our last week. Again, you will get a template that walks through a lot of this, but just as we're talking through it, that's what that would look like. So for this bill, we're going to try to work through an email template together. And if anybody is interested in doing this exercise with me, I would love to have that participation. But we're going to work through what an email template would look like as a form of advocacy for the HEAL Act. So again, to kind of recap, the purpose of an email template would be to gain support for a specific issue with your congressperson and set up a meeting to discuss further. You never want to leave an email without the opportunity to say, let's chat more, let's follow up, let's circle back by X date to see where you're sitting at with the co-sponsorship, with the support, whether or not you would vote in favor, or just if you're not necessarily sold on the idea, then why is that? Let's have a conversation. So a typical outline for an email template would include, you want to introduce yourself, be sure to state your name, your connection. If you're from that district, amazing. If you're not, also amazing, but you just want to kind of share if there is some sort of connection there. You want to state the issue at hand, the legislation, or the impact of a certain event. In this case, we're talking about the issue and the legislation. Share your personal connection or professional expertise for credibility. So I could say, I'm the Health Policy Advocacy Manager for American Muslim health professionals. This is what brings me here. You want to include research or data to support your position. And then you want to make a clear ask and communicate your expectations. That is very, very important. Then you want to thank the congressperson, request consideration or follow-up, and then include any supporting documents you may have. Does anybody want to talk through what a potential email could look like? Is anybody interested in having that dialogue with me right now?
Yes.
Yes? Okay, go for it.
Yes.
Mariam?
Okay, so I'll start with the first, like number 1, right?
Yes.
Okay, so let me say maybe talk to one of my senators here in Texas. So good afternoon, Mr. Ted Cruz. Nice to meet you. I'm your constituent from Dallas, Texas, and I would like to, advocate for the HEAL Act, right?
Mm-hmm.
Okay. So I'll say the issue at hand. Wait, I wrote it down somewhere.
We can go back. That's helpful.
I wrote it down in my notes because I'm taking notes. So I would like to discuss with you about the 2646 bill.
Mm-hmm.
That's the Senate bill, or the House of Representatives 5008 bill.
Mm-hmm.
I'm a public health professional working with senior citizens ages 62 and above in Dallas, and I would like to discuss with you about what they are facing in terms of their social determinants of health. Right?
Yes.
Okay. Is that okay, or should I go on? I think that's okay.
Yeah, I think that's a really good start, and especially for doing this live. Thank you for doing that. That was very good. You stated the legislation, you were very clear, you introduced yourself, your connection to them. This is another template that we could work through. And again, y'all will have access to these, but this is a sample email that I have sent out. And this is, built out over time. But thank you so much, Mariam. Yours was a very good start, and you went through the bullet points very well.
Okay.
So in this case, you could say, hello, this is another example. My name is Ashila Juwani, and I am the Health Policy and Advocacy Manager with AMHP. I'm reaching out to ask, let's say Ted Cruz, to consider co-sponsoring the health equity and access under the law for immigrant families. Attached, you will find a few reference documents discussing the legislation in detail, but I have highlighted below brief facts about HR 5008. So this bill will remove unnecessary barriers to health access for immigrant families, provide access to public and affordable health coverage for DACA recipients, provide access to Medicare, Medicaid, or CHIP to lawfully present immigrants without the 5-year waiting period, allow undocumented immigrants to purchase health insurance through the Affordable Care Act marketplace, and create a state option to expand Medicaid and CHIP eligibility to undocumented immigrants who are otherwise eligible. AMHP is on the rewrite committee for the HEAL Act and notices the great value this legislation will have for improving healthcare access. I would value the opportunity to schedule a 30-minute meeting sometime between, you can insert time and date, and I would prefer an in-person meeting at the representative's Capitol Hill office, but we can also host the meeting via video conference if that is more convenient. Please let me know of a convenient time that would work for the representative and yourself. We hope that you will join 250 plus organizations in supporting the HEAL for Immigrant Families Act to allow immigrant families greater access to healthcare coverage in this critical moment. Feel free to reach out with any questions or concerns about HR 5008. I look forward to meeting soon to discuss this legislation further. So this is important to kind of work through in the sense of we have the introduction, we have the content, and you want to close off with a clear ask, a follow-up, and creating a space of welcomeness, and you want to thank them for their time. If they don't respond to your email, do not be afraid to follow up within the week or two. The email could have gotten lost. There's a lot of emails that are coming into the staffers' inboxes, but again, don't be afraid to follow up. Mariam, thank you so much for engaging in this exercise with me.
You're welcome. I have a question.
Yeah, go for it.
So if you want to meet with any of the representatives or any congressman, are you supposed to mention, so these are two different bills because I think they both refer to the health equity, the HEAL Act. So are you supposed to mention both, or is it okay to mention just one
So
of them?
actually it's the same bill. The HEAL
Okay.
Act, sorry, I should have explained that. I just made an assumption. I say this all day. So I apologize for the confusion there. HEAL Act is the health equity and access under the law for immigrant families. It's just it's taken the first letters of each of those words and pulled it together. And so you'll see here, right here, it says the health equity and access under the law, and that is HEAL. So the HEAL Act is literally the same thing.
Yeah, I mean the S24, like the
sorry.
yeah.
Depending on the meeting you're having, you can say HR 5008 or you can say S2646. I typically just say both. That way they know it's been introduced on both sides. But in your log, and I usually flag and say, on the House side, it's HR 5008.
Okay.
It's been introduced on the Senate side as well. And this is the number for that if you want to track.
Okay. Yeah, that's okay. That makes sense. Thank
Sorry,
you very
I
much.
understood your question.
Thank you.
Of course. All right, on to the next legislation. So the American Opportunities Account Act, which is also known as baby bonds colloquially. So this legislation falls into our health equity space, and you'll see why when we kind of talk through it. So baby bonds is this landmark national legislation to address the growing racial wealth divide. Growing up without wealth can limit specific children's opportunities by putting them on an uneven playing field as young adults. So ultimately, just by listening to that, you can see that there is lack of equity here. While a young adult can be born into wealth who will likely get help paying for college or buying their first home or having access to healthcare, someone who's born into a lower wealth household is starting at a zero space or a negative space. And that means that they're already behind based on their counterparts of, other people who are in different wealth categories. So this might impact them on taking student loans, having higher debt, and it makes it much harder for them to become financially stable and build wealth because wealth ultimately is passed on from generation to generation. And a lot of people in this country did not have access or the privilege to generation wealth building because of systemic racism, systemic barriers. And ultimately, that is what this bill is looking at. It's looking to level out that playing field so that even young adults who start off on an uneven playing field can have access to some of that wealth to help build them up. So to address this wealth gap, there was an Derek Hamilton, I believe, is in economics, proposed creating baby bonds, which would provide every child starting at birth with a specific bond that can grow over time with them. So baby bonds would help children of color to begin their adult lives with the economic resources that they need to build long-term security and have access to wealth. So this bill would establish a tax-exempt American Opportunity Account to provide children at birth with a $1,000 savings account with an annual contribution up to $2,000 depending on family income. So now every child would not get the same amount every year, and it would depend based on your family income and where you fall in that category. So the accounts are available for children at age 18, and they can use it for anything that they want, mostly focusing on educational expenses, home ownership, investments that provide long-term returns. And this account would only be eligible for the children to access, not their families, not friends. It is solely for the baby who has grown into adulthood at age 18 to access this bond. So one study has looked at the impact of national baby bonds programs, and if it had been impacted or if it had been enacted in the mid 1900s with the average size of baby bonds for households with the wealth in the bottom 20%, totaling around $45,000. The study found that the wealth gap among participating households could have narrowed from white households having 15.9 times the wealth of Black households to having only 1.4 times more wealth. So currently, there are 31 co-sponsors in the House and 15 in the Senate. This bill was introduced on the House side by Ayanna Pressley and on the Senate side by Senator Cory Booker. So as you can see, the number is S441 and HR 1041. So some fun statistics on this, and I've noticed on advocacy work that these statistics are a great hit. Under the bill, on average, a Black child could accrue almost $30,000 by age 18. A Latinx child could accrue almost $23,000 by age 18, and a white child could accrue almost $12,000 by age 18. As of February 2023, baby bonds have also been passed in DC, Connecticut, and California, and have been introduced in many other states at the state level. So it would be incredible to see it passed as federal legislation. While this bill does not come off directly as a healthcare bill, it has the ability to impact people's health outcomes, community health outcomes, and ultimately has the ability to protect children and allow them to have more bandwidth to do the things that they want, go to school, have access to healthcare, support themselves, ultimately, which impacts their health outcomes. So a common argument for this bill is that, well, we need more immediate solutions. And yes, that is true. We do need immediate solutions, but that does not take away from the long-term solutions that we also need to address the wealth disparities that are impacting certain communities to ultimately not have access to the same resources and the same bandwidth, essentially, to pursue the decisions and the lifestyle that they also have rights to. So again, this is called American Opportunity Accounts Act, also known as baby bonds, has been introduced on both the Senate and the House side, currently still looking for co-sponsors. There is a lot of momentum around baby bonds. There is an organization that is directly focused on doing a lot of the research for this, and we'll kind of talk a little bit more about that in their social media posts. But this bill, again, is a really catchy bill because people love hearing the statistics on how much money people could have access to. But again, a state that would be really interesting to follow in this case is Connecticut, because they did pass it, and they basically looked at their state budget and said, well, where do we have money left over? And they pulled together money and scraps of money and were able to allocate baby bonds to kids who fell in a certain income bracket. It was not for all children. So for this bill, we're going to look at social media posts. How do you create a tweet, a little catchy Instagram caption, when you're posting something, when you're talking about something, what is a quick, witty way to get people's attention to gather that support in your community? So the purpose of a social media post is to gain support for that specific issue with your general community and to share updated information. You might not be trying to convince somebody at that moment, but you are looking to gain support and traction and get it into people's general vocabulary, get it into people's general day-to-day thoughts. Like, oh, that's really interesting. I hadn't thought about a baby bond. I hadn't thought about what that looks like. So does anybody want to help make a quick little catchy social media post with me? It can be literally 2 sentences. Think about 150 words or less, or characters or less, sorry. But again, there's a template that we have listed here, and then we'll kind of go through some examples too. Anybody want to participate? Okay. Well, then we will kind of go through the examples and kind of talk through that. And if you'll have questions, you can stop me there. So for this template, you want to recognize who your audience is. Is it people on Twitter? Is it your friends? Are you on Facebook? Is it more family members? What are we looking at here? You want to state a quick fact or a piece of information that serves as a hook. You're really trying to gain someone's attention very quickly, and then share a resource for the audiences to learn. So these are some good examples of social media posts that actually Prosperity Now, which is the organization I'd hinted at a little bit earlier, they are the organization that does a lot of the research on baby bonds. And so they would be a good organization to follow. Again, I will share all of this with you all later so you'll have access to it. But this is an example of some really good social media posts. So I will read through a few. I won't read through all, but just for the sake of conversation, we have something to reference. So everyone should get the chance to build their financial future, not just the few who have been born into wealth. Hashtag baby bonds can help us achieve this. And then there's a link. Wealth distribution in the United States is unequal, and it's even starker when broken down by race and ethnicity. Baby bonds are a policy solution that helps us level the playing field and bridge the racial wealth divide. Learn more at Prosperity Now. We must invest in babies who are born into families without wealth, who are disproportionately Black, Latinx, and Indigenous, and begin to level the playing field. An investment in baby bonds is an investment in racial economic justice. So these are just a few examples. Again, social media posts can be really catchy because they can open dialogue. It grabs people's attention, and it starts a conversation in a more casual manner. But again, this is something that you're using more for community engagement, really building that support, building that momentum as we're still building up the platform for this. Does anybody have any questions about that or baby bonds?
Just one comment, Sheila, that some of these are more financial statements, but you can also, like everybody here can, you know, if you're in the healthcare arena, connect it to healthcare as well. That secure the financial future of babies today to ensure a healthier tomorrow. Like something like that. Like you can, I'm making this up obviously. So you can, so just to connect it to the vision that you have in your minds. And of course, these are wonderful examples and they can serve as an inspiration to connect it to the areas of your expertise.
Yes. And going off of what Senna just said, which that was very helpful. Thank you, Senna. Advocacy, when coming from your personal experience, is the most effective. So whether your expertise is in the economic space, whether it's in healthcare, when you can speak from your personal experiences, your lived experiences, your expertise, that is going to be the most effective because then you can back your conversation as well. You can then also have access to other forms of resources that dive into whether it's economic conversations, you know, agricultural conversations, healthcare conversations at your fingertips, that when you need to reference, you can outsource and learn from those to back your conversation.
I have a question, Ashila.
Yes.
Yes, prior to this, you mentioned about the S441 and the HR 1041.
Yes.
And you said they're looking for co-sponsors. Please, can you explain that?
Yes. So when a bill is introduced, in the House and the Senate side, you want more people to co-sponsor. And what that means is other representatives and senators to sign on to the bill to have more backing and weight. So a bill can be taken to the next step at any given point once it passes through committee, once it's introduced in the House or the Senate, it goes to committee, then goes up for a vote. But the more sponsorship you have in any capacity, so you want representatives and senators to sign on early on before it's going for a vote to say, we back this bill, we support this bill, we back what it stands for, we are here for it. And that's what you're gaining, that's what you're looking for. So sometimes you see legislation that has a lot of co-sponsorships, and typically in those bipartisan bills with Republican and Democrat support, it's amazing to see those high numbers. And that's typically a good sign that it will pass. It will get voted on. And so the co-sponsorships are a good way to gauge support and create the momentum for the bill before it comes up for a vote.
All right. Thank you very much.
Of course. Good question. All righty. The next bill we are going to be talking about is the Black Maternal Health Momnibus Act. This is a compilation of 13 bills, ultimately known as the Momnibus. So the United States has the highest maternal mortality rate of any high-income country and significant disparities in outcomes. And as we all, I'm sure, are aware, have read, that the crisis is only worsening. The maternal mortality rate in 2021 was, I think, 89% higher than the rate in 2018. And the Black Maternal Health Momnibus Act will address this crisis through historic investments that comprehensively address every driver of maternal mortality, morbidity, and disparities in the United States. So for context, the Black Maternal Health Momnibus was reintroduced in the 117th Congress, which was the last Congress, and is an ambitious and very critical package of legislation that aims to address the maternal mortality crisis facing the United States nationwide. So Black women are 3 times more likely than their white counterparts to die from pregnancy-related causes. And that statistic doesn't even really capture the many women and birthing people who are experiencing pregnancy complications and misses that happen. So this stems from, of course, systemic racism, inequalities, racial disparities, and maternal health needs to be tackled from a very comprehensive set of solutions, which is why this bill falls into the social determinants of health category. We're looking to address maternal mortality from all parts of a person's world, a very holistic and systemic review, and saying, we don't just need one solution. That's not going to cut it. We need solutions from every angle, which is why it's a suite of 13 bills, which addresses issues ranging from the many social determinants of health, maternal mental health, perinatal workforce development, climate change, and just the unique circumstances that people in all different backgrounds experience. So the Momnibus builds on existing legislation to comprehensively address every dimension and angle of maternal health. The 117th Congress, the last Congress, actually took the first step and passed the Protecting Moms Who Served Act in 2021. And so now the 118th is looking to pass together this comprehensive legislation. So the Protecting Moms Who Served Act actually looks to help advance our understanding of the scope of maternal mortality and morbidity among veterans. And it focuses on racial and ethnic disparities and is making a critical investment in maternity care coordination through the Department of Veteran Affairs. So that act was passed and it was a really incredible moment. But now to really address the health disparities in maternal health and mortality, the structural inequities at the root of social determinants of health and health outcomes have to be addressed. So this bill currently has 191 co-sponsors. On the Senate side, it's 1606. On the House side, it's 3305. I believe this bill on the House side is actually introduced by Representative Lauren Underwood. Lauren Underwood, for those of you who may not know, is a nurse by training. So it's really cool to see more nurses in action. I'm a nurse by training, so it's really cool to see that. And on the Senate side, I believe it's Cory Booker. And so, again, I won't read directly off the slide, but you can kind of see that these are the 13 pieces of what it's focusing on. So all in all, the main focus is maternal mortality is resulted from many, many, many different reasons. So to address it, we really need to tackle it from all of these different reasons. So your advocacy could be focused on many of your expertise that might be directed at one of these 13. You might be an expert on mental health in maternal spaces. You might be more passionate about WIC resources, which is women, infant, and children resources to access nutrition. You might be, looking at, we don't have care providers who look like the people who are being marginalized. We need more Black providers. We need more brown providers who are actually in these spaces. You might be interested in community-based solutions, looking at climate change. You might be looking at different parts of this bill that you might want to be an advocate for. You don't have to be an expert in all 13 parts, but you can feel connected to one or a few of these that ultimately backs your reasoning to why we need this bill to pass to ultimately protect our women so that we are not losing women at such an exponentially high rate for something that is completely preventable. So for this bill, we'll kind of focus on a very quick form of advocacy. It's a phone call template. This can be used for urgent actions. Let's say this bill was up for a vote. It was coming up. It is not, we're not in the vote section of this bill yet, but let's say it was up for a vote, then we would be really mobilizing and saying, we need people to call their senators and representatives. We need you to call, ask them to support, tell them why, really, really go in on that. And sometimes the phone calls feel like they're not helping, but they really are. They are useful. Those staffers are taking notes and are really passing this information down to those representatives. So the purpose of a phone call is when reaching out to your representative or senator to request support on a matter, or it could be to schedule a meeting. But in this case, we're going to be focusing on asking for support. An outline for this is you want to introduce yourself, state your name, what's your quick connection, state the issue at hand. You want to share your personal connection, your credibility, what brings you here, make a clear ask, communicate your expectations, and thank the staff in the office who's answering your phone. Chances are it's not the congressperson who's answering, it's a staffer, and they are working really, really hard to make sure that everything gets addressed. So be kind to them, show them gratitude, but make your ask and be quick and give them a follow-up if you want to give an email, your phone number, whatever that looks like. And then if you want, and I highly encourage this, ask them to share their email because the staffer is answering, and they will have a direct email, and then follow up with them with an email. So this kind of allows you a two-pronged approach to advocacy. Does anybody want to do a mock phone call with me? It'll be really quick, I promise.
Sheila, you want me to do it?
I'd love for you to do it.
Okay. All right. I can jump in. So I'll get started straight away in the interest of time. So I'm based in Massachusetts. So I am calling my senator, I guess, Ed Markey or somebody.
Okay.
So, so my name is Sana Sayed. I'm a resident in Massachusetts. I am a neurologist in Boston. I'm calling you to discuss the Momnibus Act. And as a neurologist with a public health expertise, I feel very close to this topic because it impacts Black maternal mortality, and that is a public health crisis in this country. So I would appreciate the support of the senator on this bill. I would also like to provide you with my phone number so that you can connect with me and inform me of your next steps in supporting this bill. And thank you for taking my phone call. And I look forward to hearing from you.
Wonderful. That was so good, Sana. It's like you've done it before.
Maybe. Sorry.
So exactly what Sana did was amazing. You could pretty much copy and paste that and it would work really well. You're basically shrinking a little bit of your email and using that in conversation. So I won't read this because I think Sana said it pretty, identical. But this is, again, a good example. Again, I want to highlight that these templates will be shared with everybody. You will have access to all these resources. These are not mine. These are for everybody to use. We want people to replicate, utilize, and be an advocate in the best ways you can. I'm going to pass it off to Sana to talk a little bit more about advocacy for Palestine. So Sana, let me know when you want to click on one of these and I will go for that.
Sounds good. Thank you, Sheila, very much. So we were cheating a little bit because I am a board member of American Muslim Health Professionals, and I worked for a few years as the policy director for AMHP. I am a neurologist in my day job, though, and I am involved in a lot of research. So we did want to recognize the global crisis that is happening in Palestine as well. Obviously, American Muslim Health Professionals is an organization that works primarily on domestic issues in the US, and that is our area of expertise, is working in healthcare issues in the US. But we have been ensuring that we're connected, or at least aware of resources, so we can connect our members and our allies on the Palestine issue as well. So what we have on the screen here is a Palestine resource guide that has been developed by the Council of American Islamic Relations, CARE. And Sheila can click on it, and it will take you to the page where they show sort of the next steps. And we lost your screen, Sheila.
Right now.
There you go. So this is, you can see like they have indicated how to take action, how to contact folks. They have talking points. I will indicate that everything that Sheila provided today in terms of outlines and high-level guidance, all of that can be translated to this issue as well. Obviously, you will have to do some research, and this page is a good resource to obtain that background information to facilitate your conversations. So this is one of the items that we wanted to flag for you. The other is there is a group that has been recently created, Doctors Against Genocide. They do welcome all health professionals who are committed to fighting genocide all over the world. Right now, as it happens, it's focused on Palestine. They are relatively new, but they have already held a day of advocacy on the Hill very recently, as of last week, and they did a press conference there as well. It would be good to just keep an eye on like their activities. They have, as you can see, their pages outline what they have done thus far, and it will also likely include future actions as well. And they also have a toolkit. These are the different resources. We at AMP, since we're not actively involved in this ourselves, but we also collated a guide with different organizational efforts going on in this area, just to facilitate those who are interested in working in this cause. So those were just points for that we wanted to raise on advocacy for Palestine for those that are interested. And with that, if you're sharing your screen again, Sheila, we can just go to the next slide. Did want to highlight a future event that American Muslim Health Professionals is conducting in collaboration with American Muslim Medical Students Association and Johns Hopkins Medical School and Public Health School as well. We are holding a conference. Yes, we will be sharing the resources. Yes. Aman had a question. Sorry. Coming back, we will be holding a conference next year in February 2nd and 3rd at Hopkins, Johns Hopkins in Baltimore. It is themed around health equity. So along the lines of the different work that the advocacy work that we've done, it's on similar themes, but obviously it's broader. The overarching theme is building bridges to advance health equity and social justice. We will cover areas ranging from mental health to advocacy in clinical care, to anti-racism guidelines in healthcare, to professional development aspects as well. Since it is health equity, the conference really reflects the diversity of expertise that is required in the space of health equity. And our speakers come from different backgrounds, not just as matters of race or ethnicity, but also expertise as well. They include physicians and nurses and as well as even lawyers and public health advocates. So you can see this flyer just indicating the different speakers that have confirmed. And if you scan the QR code or go to our website, you can see the details, including the agenda as well. And with that, let me just pause if there are any questions for Ashila probably, but I am on the line as well.
Open to questions. Well, if there are no questions, again, we just want to highlight that in these moments of advocacy, do not forget yourself. You are critical, you are important. You have to find space and stay grounded so that we can do this hard work. So please make sure you are taking time for yourself, find people around you, chit chat with them, share your resources, talk through what you're feeling, and give yourself the time to also process and go through the motions. I do want to highlight that all of these resources will be shared, the recordings, the slide decks. We also have templates that you can utilize and literally broken down step by step, model emails, model posts that you can utilize. And then of course, always I'm available if you need to chit chat, talk through some things, feel free to reach out to me. But again, please stay connected with us. You can follow us on social media. You can go to our website to see upcoming events. We have other things that are always happening. We'd love to see you at our upcoming conferences. We'd love to see your support at upcoming events. But we thank you all for being here today, taking the time to, really learn about advocacy in this two-part series. We know so much is happening in the world right now, and a lot of us are, really feeling it and, experiencing it a lot from a personal level. And so we just want to take the time to thank you all for taking the time to be here today and giving us the space to talk with you about advocacy efforts, because you all make advocacy. And the more people, the more impactful, the more stories, the more impactful, and everyone's lived experiences are really, really important. And so thank you so much. We hope everyone has a really good week. If you have questions, please reach out to me directly and I would be more than happy to chat.
Thank you, Ashila.
Thank you.
Excellent presentation. Thank you.